Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to this episode of the Sensei podcast. It is my great pleasure to introduce Dr. Alfredo Galassi from Palermo, Italy, one of the fathers of CTO intervention in Europe and around the world. Freddy, good afternoon and thanks for joining us today on the Sensei webcast.
Thank you very much, Manos, and hello to everybody, the people who are listening or viewing this interview. Thank you very much.
Thank you. Thanks, Freddy. And again, you've been one of the instrumental people for CTO PCI around the world. You've taught the procedure in countless people, thousands of interventionalists, literally, and had a lot of impact on people's lives. But let's start from the beginning. How did you get into this? You were on this very early, right? You started CTO PCI very, very early. How did this all happen for you?
Well, it was really a very good opportunity for me to go abroad. I was at Singapore live meeting and I met Dr. Ochai, who was doing a live on CTO. At that time, I was involved in bifurcation. And once I saw Dr. Ochai doing this CTO, I was really impressed. And I said, I have to go back and start to do these kind of things in my cath lab because I was really impressed by him and by his expertise.
Perfect. So what year was that? When did that all start?
It was 2005. So
perfect. So the early days of CTO, the retrograde. And then how did you learn? So you saw Dr. Chiai do these cases, but then obviously from seeing a case to becoming good at doing the case, there is some need for practice. So how did that happen for you?
Well, basically, it's just a matter of willing to do and studying and looking at the coronary arteries and try to following advice from mentors and basically getting involved in this interest. And I think that was the main drive because at the beginning I was really interested in bifurcation. At that time, bifurcation was really a little bit cumbersome and probably nobody knew and understood how to dealing with bifurcation. But then at the same time, CTO was very interesting as well. And then everybody was really interested in doing that. And so basically everything started because of the interest in what I was doing in interventional cardiology, which is my first love.
Perfect. So you started doing those cases and you start getting better and better at this. Did you work with other people? Did you learn it more by yourself? How did that work at these early days of the procedure?
Basically, I started at that time in Italy, nobody was doing CTO. In Europe, there were few people. And I started to invite Dr. Ochai in my cath lab, and he was really, actually, I went to see him in Japan. And then after then, I invited him in my cath lab, and then he came to my cath lab, and we worked together in some cases. And then from that point, I started to do myself, and with the willing of doing, like Rocky Balboa, starting to exercise every day, with the aim of doing the best. Of course, I was starting with the very few materials at that time, very few, very, paying attention. And then all the cases that I was not able to succeed, I was regaining retrying with the Dr. Ochai when he was coming to my place. And then since then, I started to my main interest in that.
Perfect. So again, since then, you've obviously become one of the world's leaders on doing this procedure. How do things feel like now? Do you find the cases easier? Are they still hard? Are you tackling more complex cases? How are things working now after so many years that you've been doing this procedure?
Well, I must say that, of course, now it is different from the previous years because, first of all, the expertise is different, but also the materials are totally different. So nowadays we are really facing a lot of good materials for doing PCI, CTO, and generally speaking for interventional cardiology that allow the operator really to avoid a lot of cumbersome issues, and this makes the procedure much easier. Despite having said that, I would say that my approach to CTO is always the same. And in these regards, I'm really very similar to the Japanese approach that basically look at the patient every time in the same way, with the same attitude, looking carefully at the indication first, at the patient willing to do, at the possible strategies, antegrade, retrograde. Nowadays, we have so many different possibilities. And also looking at dedicating time to the procedure with a CTO day, no hurry, no pressure from anybody, in order to devote all the time for looking at the case. Also working with the possible alternative as second operator, which makes the things much better, because it may be junior, maybe senior, maybe so working with another doctors is also 4 eyes are better than 2. And also I would say that probably best is to work in an environment where all the people knows what you are doing, not only yourself but also the technicians, the nurses, and this helps you to keep the procedure safe. So basically I would say that the approach is similar to the past, but nowadays is much easier and quicker.
Perfect. And you said you do the cases on specific days. So there's specific days in the week that you do CTOs, or you do them anytime that you're in the cath lab these days?
No, generally speaking, I devote one day on one session to CTO, either because I go abroad or I go in my cath lab as a teaching session, or because I decided, even if it's not a dedicated session for teaching, I decided to dedicate the time for the CTO in a special session.
And how long do you look at the angiogram? So everyone agrees, as you said, that you want to look at the angiogram, prepare very carefully. How long does that take you, with all the experience that you have, to look at the angiogram and analyze it?
Well, definitely with experience you learn a lot, but still I think that the most of the difficulties comes from the basal angiogram. Sometimes the basal angiogram is not properly performed, so you might not be able to assess all the issues that you might think are relevant to the case. So sometimes when you re-angio the patient before doing the CTO, you just do in that situation the real evaluation, the real proper evaluation. And probably sometimes the things may change because the patient can also change collaterals, route or flow or antegrade flow, and also some other possible intrinsic situation relate to the patient. In some other occasion, it may also change your strategy, because looking better to the procedure and to the angiogram, you change your strategy. So I would say that this is a very important part of the CTO, the proper analysis of the angiogram, which sometimes may be done only with a proper coronary evaluation.
Perfect. And then when you start a case, do you get nervous at this point? Are you fairly comfortable with those cases? Do you get still anxious for some complex cases? How do you handle some of the, because I'm sure you get some of these very failed procedures from all over Italy that are very complex. Do you still get nervous? How do you handle that?
Well, actually, I'm lucky in this according to this question, because I'm never anxious. Actually, in the early ages, when I was very young, I had a little bit of anxiety before doing live cases in front of a lot of people. But nowadays, I'm very relaxed, because I even something might happen, I know how to handle, or at least I hope to how to handle, and at least I try to start with all the possible strategies that I am aware of. So I would say that, but this is just something that it depends on the personal character of the person. I mean, the personal behavior. I'm never be. I have a good. I am lucky in a way that when there is a problem, I have a cold assessment of the issue, and without getting anxious. And so this allow me to analyze in those few seconds, or sometimes minutes, what to do in the best, for the best for the patient, for the best possibility for the patient. But that is something that is depending on the attitude of the operators. And I'm lucky in that.
And when did you feel like that? Because obviously you're doing it for a long time. Was there a specific time you became so confident like this, or from the beginning you felt like, how long do you think it takes for people to get this comfort?
Well, the comfort is something that you might have inside your body, and then of course you can also improve. After many years, you improved a lot, but still you always keep to remember that there is no time to stop to learn. You always learn from each case. Even after 20 years, I'm still learning how to make something better, how to reduce the time, how to reduce the contrast, how to improve reducing the length of the stance. So learning is a process that you will never finish, and you will always learn in years after years. The only difference is that in the past you were doing a lot of stress and effort. Now you are more relaxed, and you get probably better results with less effort and less anxiety. I mean, this is probably.
And how do you learn now? So every case that you do helps you learn. Other ways to learn? I mean, you go to every meeting pretty much. You see all the major publications. What is the best way you think to learn in this stage in your career?
The best way to learn is, first of all, always to approach each case looking at what the research has been doing in that regards, according to strategy, according to experience from other people, according to case report, according to analysis. And this is the most important issue for me. Because based on research, based research medicine is the most important issue. Then, of course, mentors and also what the people explain to you in a simple way, because these mentors, Japanese, especially Japanese, but also other people who are nowadays great experience in cases, explain to you how to handle the cases in a very simple way, and you learn from them, talking with them, discussing with them cases, and looking at them also when they work in live cases. So and then doing the cases as well is a very important part of the teaching learning process, because once you are you can know all type of sort of training, but if you don't do the training yourself and you don't exercise yourself, you will never learn it. So doing cases is a very important issue. More you do, more you learn. More you do, more you learn by mistakes and by good things, and then your expertise is growing.
Perfect. And I know you've actually, as you said, you published quite a bit. Your IVUS paper for CTO is one of the classics in the field. You published indications, several of the Euro CTO documents. So you've always been publishing quite a bit and teaching other people through publications. Was it something natural for you? How did you decide to do all these papers?
Well, actually, I was lucky because being in the university allowed me to face a lot of fellows, young cardiologists, young interventionists, and so basically being also obliged to teach them, and together with them getting the best from them, which is the interest in research, interest in new things, in new approaches, and so you are always on the not on the routine clinical work, but on the routine research work, which is something totally different. And this the facing with young fellows make you pushing you in the terms of producing research, producing ideas, and starting to have more and more new approaches in this field, which is so heterogeneous, so different, so fantastic. Because the CTO interventions is really so complex in terms of the differences of the case, which each case is different from another one, and this makes the beauty of the CTO itself.
Perfect. And you've mentored hundreds of people there as well, and now as a professor, you also have people on every day. So when you select someone to work with, one of your students, what makes you think that this is going to be a good student, is going to become a good operator, CTO? Is there something that makes you think that this person is special? How do you select the people you work with?
Well, there are two issues which I think really are very important for somebody who wants to become interventionist. First of all, it is the willing of doing interventions, which is important. Actually, there are three. The second one is the fact that you should be um, in the hand in the way of having a practicality in your work. We call it this one right hand or two right hands instead of two left hands, and thirdly, I think to mix up research attitude and clinical experience, because in my opinion, research is very important, but also the clinical feeling of what you are doing and what you are experiencing from that what you are doing is very important as well. So you have to conjugate, or you have to mix up both research and clinical experience in your field of action. So those guys which have all the three aspects, I think, are really very, very good for me and are really pushed in this direction.
Perfect. And then, you know, being with the students, having to teach them all the time, does that help you also learn? How do you, and you're a very busy man, obviously, with a lot of responsibilities at the university and your life cases everywhere. How do you balance all this, teaching and performing and treating patients? How does that work?
Yeah, you got the most critical questions of all of them. I believe you are right. It's really impossible. Your life is struggled by so many things, and you are spoiling the time to your personal life, which is unfortunately very bad, because you are not able to devote the proper time to your family, to your hobbies, to your effort, to your sports, and this is something which is sometimes unfortunately not possible. So we are human being, and as being human being, time is that, and you have to try to squeeze it in the most profitable or profuse way. But I agree with you, this is the most difficult sometimes question to answer.
Sure. Well, again, you do a great job on this. Obviously, you're able to balance all this and publish, do live case, be at the meetings. So it's been phenomenal. So actually, if anything, you can give a lot of advice to people about how to do this. But when it comes to live cases, which you do a lot of them, how do you think of them as a teaching tool? I know that it's a cumbersome thing to organize. There's a stress involved. What do you think of them as a value for people learning how to do this procedure?
I think that the live cases is one of the most important, probably, aspect or issues of the procedure itself, because first of all, it tells you you discuss with the panel of experts the strategy, or even during the strategy, what is the best wire, microcatheter, stents, approach, IVUS, imaging, and whatever. And so you are faced against a panel of experts and a panel of people that can also have different opinions. And then usually I always try to hear from them as much as I can, but then at the end I always try to figure out which is the strategy that I should follow. Like more or less when I do sailing, that I follow the tactician. I ask to everybody, then I ask the tactician, and then the skipper should follow the tactician where to go for the best wind. Otherwise, if you follow all different directions of ideas, then you can get in trouble. So I would say that it is very important to discuss, to figure out what is the best strategy, and then to take the decision and try to proceed in that direction according to your expertise and your feelings, because feelings are also very important in these techniques.
What, do you feel pressured when you do the live cases? You know, there's the time limits, as you said, there's the panels having the suggestions. Do you feel the pressure? Do you think it's a stressful thing doing live cases, or you've mastered that art by now?
You are saying something very important. Yes, the only stress comes from the time restrictions. Sometimes you have to handle in that short time of period, and you have to handle preparing the case and trying to get the best message in that time. Yes, you are right. Probably that is the most stressful aspect of the live case. Otherwise, if I don't have a live case is stress time, I have no stress at all.
Perfect.
Actually, I will be getting a lot of good input from outside.
Exactly. So make the most of it, all the advice from the people who are very experienced, as you say.
Definitely.
Now, when it comes to the equipment that you use, you mentioned before that there's a lot of good materials, equipment that we have right now. And actually, I just read your paper on the dual lumen balloon for undergrade fenestration reentry. So you've been very creative and very innovative. So where do you think things are going? Which devices do you think are you most excited right now? The ones you're going to use down the line? Where do you see most of the excitement coming in this front?
Okay, if I must say the truth, I have to say that without a Japanese inventor of the technique, we will never have had so much development on one side. On the other side, if we would not have had the pressure of the United States friends and ideas and new innovation in making the procedure a little bit more effective in terms of effect and results and timing, probably the procedure would have been still a little bit very long. So, as usual, you have to mix up technique and also the result from them, trying to get it the best in the best time of the procedure itself, and making that good result in a short time of procedure. And in this regards, I would say that new ideas coming from the United States in terms of antegrade dissection, reentry, fenestration, and also from Europe makes probably the idea of recanalization different from the actual clean procedure of the Japanese approach, which might be sometimes a little bit, probably sometimes too long and too cumbersome. And so to conjugate or to mix up the two strategies, I think probably are the real future. In this regards, regarding ADR and AFR, I think there is a lot of space to work, a lot of new innovation, and I think that technology might help us to get a lot of good results, as well as other techniques developed in Japan, like the plasma wire, that might be probably a bit more cumbersome, but maybe also in the field of evolution. We must never forget that if we reach this level of expertise and success, is because Japanese people, as I especially, dedicated all the time to develop the best wire to recanalize these arteries. And this comes as a teaching to basically to develop new techniques. So even in AFR or ADR, we should be dedicated, we should be developing new strategies, working in that direction now, and probably we come up with good new alternative possibilities.
Wonderful. So right now, again, you've done a lot of things in your life. You're very advanced in your field. What excites you the most right now in terms of yourself, your procedures, your career? What is the most exciting thing?
The most exciting thing is probably to be successful in a procedure in a short time of period with the minimal stent implantation length, better TIMI flow results, and better outcome for the patient. And this is really what my aim nowadays is, to try to select the best candidate and try to give the best to the also to the candidate for the procedure, the best result in terms of all these aspects, which are, I think, very important in terms of also cost effectiveness, because we have to remember that these procedures are very costly, and if we reduce the time of the procedure and we increase the percentage of success, or we stay with the same percentage of success but in a shorter time of time, then it will be a success. Or nowadays we have to concentrate not only to reach the percentage of success, which is almost 95%, which is almost there, but to reduce the cost of the procedure and the complication, which is already very low, and especially for the perforations, which are mainly in the retrograde option. So I would say that going in antegrade, we might reduce also that, and reducing the contrast volume, time time and stent implantation, and that will be making the success, I would say, of the interventions.
And what do you think was the main driver for you becoming so successful? What do you think made you to be able to get to where you are now?
I think it's mainly willing to do and exercising, as I said before, like Rocky Balboa, doing every time a case and trying never to stop and never being okay. This is it, but always my approach is always the same. Nowadays, even after I don't know how many times of CTO interventions I did, I'm starting each CTO with the same approach, looking at that, looking at there, looking at the coronary artery, and trying to solve the problem, but never saying it's easy, it's difficult, it may be done in 1 minute, but always with the same with the same approach as I was doing in the past.
So what are you most proud of? You've done many things. What are you most proud of so far?
I think that in these CTO settings, I think not only me, but I think that I brought some of experience. I brought some effort in reaching a goal, which is now I would say a global goal of the interventionalist, which is that of being able to recanalize arteries, which in the past were not able to be possible to recanalize by percutaneous interventions. And hopefully, this is my hope, to recanalize as quick as possible in the best by everybody. And this is making the probably my my aim in the future, to be able to push all interventional cardiologists to this CTO or complex procedure approach, in order not only to learn the CTO, but also to learn how to do PCI and to cope with complication if complication occurs. Because we must remember that for complex procedure, you learn how to handle standard procedure. So for me, CTO is like a training gym where you can have all the possible experience that you might find in probably long span of period of time if you don't do CTO, but you do just standard PCI. And in a short time of period, if you learn CTO, you learn really, and you start to grow as an interventionist. So always I suggest fellows to learn CTO not only for doing CTO for all their life, but also to learn CTO in order to learn how to do complex cases, and then from then starting and doing standard PCI, which is the most important issue for an interventionist fellows.
Wonderful. And you mentioned before that Rocky is one of your favorite movies there and makes perfect for CTO. And actually, mine's my favorite movies of all time as well. But so is this because of the preparation, the suffering? Because, Rocky gets punched in the face several times, right? Why is it your favorite movie?
Well, you have to fail. If you fail, you need to be so strong to put effort and try to overcome the failing and try to have success. If your success is very easy, you will never push too much, and that's it. So, but I think that all CTO operator, as far as I understood, all over the world have the same behavior, to be very people who are suffering a lot and try to get after this of this effort some benefit. We learned this from Japanese tradition, and now we moved also to United States tradition as well.
Perfect. I completely agree. So what is next for you? I know you've done many things and you have a lot of teaching and cases. What is the next thing for you in the next 5-10 years?
Well, my aim will be to bring interventional in the west part of Sicily, to bring CTO interventions in the west part of Sicily, which is now where I am now for the last 2 years, and this will be done by a lot of effort. And but this will be probably the issue because I'm working right now in the west part of Sicily. On the other hand, my aim will be also to bring eventually a CTO club meeting in Sicily, in Palermo, in the next 2 years or so, and also to push all the interventional society in the direction of research and also experience, so clinical experience, interventional experience in terms of making new meetings in terms of developing what is important nowadays to be known by younger interventional cardiologists, because nowadays younger interventional cardiologists are facing a lot of device, and sometimes they don't even know how to use them, or they don't even know how to handle them. And so we are now facing a sort of different from the past. In the past, we had few materials, but we had a lot of effort to express our attitude and expertise, and we were able to do everything with few things. And nowadays we have so much material, so much devices, and the people don't even know how to handle these materials. And this is the opposite of what is should be. So I would really suggest and encourage all of people to learn and to learn and to exercise as much as possible in order to learn from these devices as much as possible during cases, which cases should be done in a very safe way.
Wonderful. And I'm sure, Palermo would be great city for the meeting. So very excited about that.
Hopefully.
But okay, so trying to sum it up, what is your advice? So the people who come to you and want to say, I'm going to do CTO or PCI, what would you advise them to do so they can become successful like yourself and learn the procedure and have great results?
Well, nowadays we must remember that we have what we call structural interventions. We have coronary arteries, and we have a lot of also different possibilities for cardiologists, because we have the imaging, we have the clinician, we have a lot of really good possibilities. So the suggestion for the fellows who want to become interventionalists and is dedicated to interventionalists should be, first of all, not worried about radiation. Secondly, should be involved in working in cath lab even for as many hours as possible. I would say 12 hours if it's possible, and always trying to be involved in all different basic research or even standard research of the technology that can help you to do your procedure in the best way. And always not forgetting clinical patient of what the patient is feeling and how the patient is followed up after the procedure. So all these aspects together bring the fellows to be growing and to grow in its experience, and never give up. Never give up, because if you persist and you continue to work in the proper way, you will get the result. It's something that it will take longer, but you will get the results.
Wonderful. Well, once again, Freddie, thank you so much. That was a wonderful overview. Congratulations on everything you've done. Thank you for all the pieces of advice you gave to us and the people who want to learn about how to do this. And again, best of success on the upcoming efforts.
Thank you very much, Manos. It was even too much for me because you are a very good friend of mine, and I really thank you for this kind of invitation. And I hope to see you soon in Palermo in 1 or 2 years to to inaugurate a very big meeting of the CTO interventionalists among all our friends, among all the world friends.
Wonderful.
Thank you very much.
Thank you.
Thanks.
Thank you for listening to the Sensei podcast.